Hello and welcome to my channel Magic of Medicine. Today we will talk about anterior vertebral beaking. Anterior vertebral beaking, as the name suggests, is the anterior tongue-like projections from the vertebral bodies. Look at the beak of this bird. The projections resembles the beak and hence it is known as beaking. So anterior vertebral beaking is of two types. First one is inferior beaking and second one is middle beaking. Inferior beaking, look here in this x-ray, you can see anterior tongue-like projections arising from lower 1/3 of the anterior vertebral bodies. And in second scenario, look, the anterior tongue-like projections are arising from middle 1/3 of the vertebral body. And in both of these cases there is a separate set of differentials, so we will look into those. So first scenario is lower third of beaking. So the mnemonic for lower anterior beaking is pant, down and lower. P stands for pseudo achondroplasia, A for achondroplasia, N for neuromuscular diseases, T for thyroid, which in pediatric population is obviously congenital hypothyroidism. Down is for Down syndrome and lower resembles Hurler. So lower is for Hurler syndrome. Again, looking at the mnemonic pant, down and lower. Remember this picture and remember this mnemonic for anterior 1/3 of lower vertebral beaking. Pant, down and lower. Now this is the x-ray of the anterior 1/3 beaking arising from lower parts of the vertebral bodies, also known as inferior beaking. So look, these vertebral bodies have inferior beaking, and the mnemonic, as we have already learnt, is pant, down and lower. Now coming to the second scenario, which is middle beaking. Middle beaking has only one example, and that is Morquio syndrome. Remember middle and middle for Morquio. So this is easier one. Now the example of Morquio or the x-ray of Morquio baby is this one. You can see the anterior beaking arising from middle third of the vertebral body. Look at these tongue-like projections. So this is the middle beaking and this is seen in Morquio syndrome. Thank you for watching the video, and the summary for today's lecture is the classification of anterior beaking. Whenever you see an anterior beaking, look at the location, whether it is on the lower third of the vertebral body or it is in the middle of the vertebral body. If it is inferior beaking, then the examples are pant, down and lower, and if it is middle beaking, then the examples are Morquio syndrome. Thank you. If you liked my video, please share and subscribe.